anorexia or diminished food intake, poikilothermia, meaning abnormal regulations in the bodies, in the organism's body temperature. These animals started to look very disheveled because they were picking on their fur. They developed skin lesions, maybe because of breakdown of their immune system. They had hormonal imbalances and even death. So clearly, sleep is just extremely important for key physiologic and bodily functions. We're going to hear more about the key health effects of sleep deprivation today. I just want to highlight a few just to prime you. I mean, obviously, lack of sleep is understandable based on what I just shared with you, that it can precipitate serious car accidents, obviously. But there are important physiological effects that can happen as a result of lack of sleep, either quantity or quality, that, for example, can lead to changes in behavior, like more food cravings, especially for carbohydrates, which unfortunately leads often to being overweight. Carbohydrates that we consume in excess are converted into fat in our bodies. And that's one mechanism through which sleep deprivation can lead to obesity or being overweight. Sleep has an intimate connection with our immune system, and therefore, when there are very, very dramatic disruptions in our immune system, we are placing ourselves at risk of having cancers, many of which have a direct connection to our immune system, as well as other conditions like diabetes type 2, which is also immune related. The effects on the brain are probably the most dramatic, as I showed you just a moment ago, not only hallucinations and delirium, but if you have someone that is chronically sleep deprived, either not getting enough quantity or quality of sleep, that can be linked with things like depression, which is a brain condition. You have anxiety. You can have definitely changes in cognition, right? Forgetfulness and just fuzzy thinking. And I'm going to be telling you more about connections between sleep and dementia in just a moment. And also effects on cardiovascular health that you're going to hear about more: hypertension, heart disease. All right, so let's talk a little bit about sleep and dementia. I think the first concept I want to get across to you is that the brain is a very complex organ in the sense that different parts of the brain do different things. And this is a picture, sort of a side view of the brain. You're looking at the right hemisphere, so the right side of the brain. And we divide the brain into a frontal lobe in this color here, sort of light yellow. Orangey would be the parietal lobe. This is the occipital lobe. This is the temporal lobe, and then the cerebellum at the bottom. The cerebellum, so what sleep does is it affects primarily frontal lobe functions, things like executive function, working memory, your ability to stay focused, to not lose attention. Sleep is crucially important for our ability to prune memories, meaning weaken memories that we don't need, as well as consolidate important memories or form new memories. So one interesting facet of sleep is the ability that REM sleep has in helping us process emotionally charged memory. So it's sort of like our psychoanalytic period of sleep. And in fact, people that have normal REM sleep tend to report higher levels of happiness during the day. All right, I don't think I'm running out of time, surprisingly. I usually go through my slides quicker than this, but I believe I have 5 more minutes, correct? Someone? Okay. So I just want to finish up talking to you about the concept of neurodegenerative disease and how it relates to sleep. So someone that has a neurodegenerative disease, like Alzheimer's disease of the brain, goes through a period of having a healthy brain. That is, if I could, for instance, this is a person that goes from being healthy to then having dementia due to Alzheimer's disease. And if I could take a sample of this person's brain in my clinic, which I can't do, but let's imagine that I can, I would look at their brain under the microscope and find out that they're fine, that there's nothing going on in the brain. It's a healthy brain. But what we've learned about Alzheimer's disease is that people can have the physical changes of Alzheimer's disease in their brain, but not be aware of it. And not only the person not aware of it, but their doctor's not aware of it and their family members not aware of it because they're asymptomatic from the disease. So this would be the asymptomatic stage or preclinical stage of Alzheimer's disease. Then people enter a state known as mild cognitive impairment due to Alzheimer's disease. This would be a state where a person is already having clear changes in cognition and memory, but they're still functioning relatively well, meaning that they're still living a good quality of life, not needing help from family members, etc. And later, they enter a state that we know as dementia. And that is when someone has severe cognitive impairment that is severe enough to really affect independent living, right? So this is what a brain looks like. We're going to say for the sake of education, this is a brain with a neurodegenerative disease, and specifically we'll say that this is a brain with Alzheimer's disease. And what you're seeing is that there's shrinkage of specific brain areas compared to a healthy brain that looks all plump and full throughout. Here you're seeing that the front of the brain looks very, very shrunken. That's what we call atrophy. So in order for us to know what's happening, what is causing the atrophy, we need to look inside of the brain. And so that's what a neuropathologist does. And when this is being caused by Alzheimer's disease, what we find are two things. Amyloid, the amyloid protein is being accumulated in someone who has Alzheimer's disease, and you can see it here colored in black. These are these fibers that you see around the neuron in dark black. You can see another amyloid plaque here and another one here. And the second thing that we see is a different protein called tau. And here also, so that it's easy to see, it's been colored in black, the neurons are colored in pink, and you see that the tau protein is getting inside of the neuron, whereas the amyloid plaque was surrounding the neuron. So when a neuropathologist sees these two things coming together, leading to destruction of brain cells, this is what we call Alzheimer's disease, and is caused by the progressive accumulation of both the amyloid plaques and the tau tangles, okay? So going back to this scheme, and now we're saying that this is the natural history of Alzheimer's disease specifically, this is what the disease looks like. You have an asymptomatic state where a person has already the disease brewing in the brain, those symptoms, and then you go into a mild cognitive impairment, and then finally into a dementia state of AD. What we've learned through research is that these proteins, the amyloid protein and the tau protein, or the amyloid plaques and the tau tangles of Alzheimer's disease, start to deposit in the brain 10 to 15 years before a person starts to have MCI, starts to have symptoms of the disease. So that's opened up a lot of research into what are some modifiable risk factors, things that we can all be addressing to protect our brains from these changes, or to slow down the disease in the brain. And this is how we come up with these non-modifiable risk factors as well as modifiable risk factors, things that if we have and we take care of, we lower our risk of Alzheimer's disease. And I think it's important to highlight that adequate sleep, so sleep is one of the risk factors that we think a lot about clinically in terms of risk of Alzheimer's disease and risk of cognitive impairment more generally. All right, so speeding up a little bit, and connecting to what I just said, we know that people that have Alzheimer's disease experience different types of sleep disorders. Alzheimer's disease can affect the circadian rhythm that you've learned about. It can also disrupt those neurotransmitter circuits that I showed you that subserve sleep and wakefulness. And it can also change our neuroendocrine system, and it can disturb our glymphatic system. In fact, we know that actually, we don't know. We're suspecting that one of the potential reasons why people develop Alzheimer's disease is because there is a disruption of the glymphatic system that I talked to you about, where in a healthy state, you have a brain that is sort of freer of all these toxins, all these debris, whereas in a person that is sleep deprived, either quality or quantity, and there's a disturbance of the glymphatic system that I talked to you about, then you have more of the amyloid beta aggregates or the amyloid plaques and the tau tangles accumulating in the brain, eventually leading to a state of Alzheimer's disease. So that's the theory, and just to give you a little glimpse of that. I want to talk to you a little bit about also Parkinson's disease, because there's an intimate connection between Parkinson's disease, which is a different disease of the brain, different from Alzheimer's disease, and sleep. And we've learned that a specific sleep disorder that you're going to hear more about today, called REM sleep behavior disorder, is a precursor or a very strong risk factor for Parkinson's disease. And this is a sleep disorder where a person is asleep and is in the REM state of sleep, where you have a lot of dreaming, but there's a disruption going on in the brain where you're having the dreams, and there's no block to the rest of your body so that you don't act out those dreams. So what happens in REM sleep disorder is that you lose that block, and therefore you're dreaming and you start to act out all of these dreams. And as I just said, it's considered to be a precursor or a prodromal or an early symptom of Parkinson's disease in some cases. That doesn't mean that everybody that has RBD is going to develop Parkinson's disease, but it turns out that it's a pretty strong risk factor. What are some factors that increase someone's risk of developing Parkinson's disease if you have RBD? Well, if you have RBD and you have a family history of Parkinson's disease, that increases your risk a little bit. If you're an older person and you have RBD, that increases, you start to develop RBD, that increases your risk a little bit of maybe developing Parkinson's disease down the road. If you have RBD and you already have some cognitive dysfunction and some changes in your motor function, which is what Parkinson's disease primarily affects, that also bumps up your risk a little bit more. And so does orthostatic hypotension, or a lot of dizziness. Things like constipation, decreased sense of smell is also linked to Parkinson's disease, and also abnormal brain imaging findings. So if you have any or all of these and you have RBD, your risk of maybe being headed towards Parkinson's disease increases a bit more over someone that doesn't have these risk factors. That's the concept. All right, and finally, I just want to bring to your attention something you're also going to hear about more today, which is this link between sleep disorders and stroke. And in here, it's primarily obstructive sleep apnea, which is a sleeping disorder where a person momentarily stops breathing in the middle of the night. And you're going to learn more about OSA today. But it turns out that OSA, obstructive sleep apnea, is a very strong risk factor for stroke, as well as cardiovascular disease and other health conditions. But I'm focusing primarily on stroke because this is a very highly prevalent, meaning highly common condition in the general population. And there's a sort of a vicious cycle here because people that have OSA, they're at risk of stroke, and then stroke in turn seems to be predisposing us to having OSA. So this is something that is treatable and important to address. OSA, obstructive sleep apnea, has been linked with mini strokes in the brain that you can see as white areas, white little patches here and here. So that's another way that OSA is affecting our brain health. And just to highlight that stroke actually is intimately related to different sleep disorders, including insomnia, duration of sleep, and other sleep disorders that you're going to hear about today that are intimately related to brain health and stroke risk. Okay, that's all I have. Thank you so much for your attention, and sorry if I went over my time limit.
No worries. Thank you so much for your talk, Dr. Lanata. Next, we have Dr. Zach. Dr. Rochelle Zach is an associate professor of medicine and an attending in the sleep clinic at UCSF with over 20 years of experience in treating sleep disorders and has a specialization in restless leg syndrome, also known as RLS. She is a sleep medicine specialist who cares for patients with sleep disorders, including RLS, sleep apnea, parasomnia, and insomnia. Dr. Zach, the floor is yours.
Okay, thank you. Can you hear me?
Yes, we can hear you.
Great. Just give me 1 second because I need to share screen. More importantly, I need to share the correct screen. So just a sec. I know you'll see both of my things up because I have to move this back over. Okay, hold on. Are you seeing the right screen? Okay.
Yes.
All right. I'm going to summarize the report from the Global Council on Brain Health along with the AARP on sleep and aging and do a more general discussion about clinical disorders. I just want to say I really enjoyed Dr. Lanada's talk and thought it was really quite edifying. So they were basically looking at individuals over the age of 50. It's a Oh, what happened? Sorry. It was a good news, bad news story in that 44% had excellent sleep, but that still left 23% with fair or poor quality sleep. Now, I apologize because I just put this next slide in the wrong order. But let me just detour for a second and sort of give you an idea of the flow. Where I'm going to go from here is, again, some basic underlying physiology of sleep as I head into common sleep complaints, sleep and aging, sleep disorders. But before I hit the general physiology, and I want to just acknowledge that there's a pandemic going on, and I want to use that to give a little bit of history, because what this slide is from a prior pandemic. This is 1917. This is the Spanish flu. And it is very important in terms of the history of sleep, because Dr. Lanada actually did a slide that I do when I teach the fellows, where he showed you the different circuitry in the brain between the circuitry of the wake promoting centers and the sleep promoting centers. Why do we know these are two different things? We do talk about an on-off switch, but wouldn't you think that, okay, you're either awake or asleep, so isn't sleep just non-wake? Actually, they are two very tiny, very close, and very different sections of the brain. And how do we know this? We know this because of a Viennese psychiatrist, von Economo. Now, he ended up working in a psych ward during World War I, and he was noticing that some of the people who were struck by the Spanish flu were incredibly sleepy, and you couldn't wake them up, and they couldn't maintain alertness. Others were hyper alert and couldn't sleep. And in that day and age, doctors did everything. So here's a psychiatrist dissecting brains. And in fact, he showed that actually the sleep and wake center are different. They are in two different sections. So pardon my little side trip into the world of sleep history. But given that we are in a pandemic, I just thought it was sort of interesting. Okay, hold on. Why is this not? There we go. Okay, so what are the normal changes of sleep with aging? And I'm going to actually hit on this a couple times. Number one, bedtime shifts earlier. So there's actually a reason that you could be waking up at 5 a.m. Sleep will becomes lighter, it becomes more disrupted, and it becomes more disrupted. Hold on a second. Okay, there we go. So Dr. Lanada mentioned this, and he mentioned a couple concepts, and he actually had a variation on this. I want to show you different brain waves so that you understand what we're talking about when we talk about different stages of sleep. Sorry, right here, these are the brain waves of wakefulness. As we scroll down, I'm getting into deeper and deeper stages of sleep. What do you notice? The brain waves are slowing down and they're getting taller. And what this is actually doing is showing sort of a disconnect between your body and the outside world. As you get into deeper and deeper stages of sleep, you get sort of disconnected from sensory stimuli. In fact, one of the ways we define depth of sleep is not just by the brain waves, but also by how hard is it for me to wake you up? How loud a bell do I have to ring? How painful a stimulus do I have to exert to get you to wake up? And it is these slow waves that we see in deep sleep. They're an indicator of depth of sleep. But look what happens next. These are the brain waves of REM sleep, rapid eye movement sleep, dreaming sleep. And Dr. Lanada actually mentioned this. If you look at these brainwaves, they look a lot more like these brainwaves of wakefulness than they do of sleep. And indeed, as he mentioned, we do a lot of thinking during REM sleep, i.e. dreaming. Okay. Again, Dr. Lanata had a similar slide. This shows the trajectory of sleep during the night. This is wakefulness. This goes into non-REM sleep, going from light to deep, into rapid eye movement sleep. And as you can see, during the night, the percentages in each sleep cycle, each non-REM REM group tend to change. And you go from being predominantly non-REM sleep to being predominantly REM sleep. So one's shortest REM period is here at the beginning of the night. One's longest REM period is here near the end of the night. So it's very common to awaken from a dream. In fact, if you look at this person went from REM to wake. REM to wake. That is actually normal. But normally in the middle of the night, people just sort of turn over and go back to sleep without remembering they were awake. But awakenings from REM sleep are fairly normal. And we see here, though, that deep sleep is predominantly early in the night. Now, again, Dr. Lanata did a newer version. This is an older version of the slide about time in bed versus sleep. And this is really important. And I actually, in my practice, spend a lot of time focusing on this. See this line here? This is time in bed. This is age. These are various percentages of sleep. And so total sleep amount is this top line here. And what you see as one goes out is that from adulthood, the total amount of sleep tends to be fairly constant in the 7-hour range. But if you look here, people start to spend more time in bed. And you will see later when I start to discuss donut hole sleep, what this can do is increase the amount of wakeful worry. So it's important to understand what is a normal amount of sleep and what is too much time in bed that may end up fragmenting the sleep into little chunks, i.e. donut holes. Okay. Why do we sleep? Again, Dr. Lanata mentioned it. Oops. Oh, I'm sorry about that. Oh, shoot. Yeah. I hope that you're not hearing the little blinks and alerts that are coming in on my computer. Okay. Why do we sleep? Memory consolidation. And it's actually very interesting. There was a time when we sort of said, REM was for the brain and non-REM was for the body, but we really know that most stages of sleep, in fact, are necessary for memory consolidation. Immunity. You need sleep to have a healthy immune system. Again, Dr. Lanata referenced the classic studies where if you take rodents and you prevent them from sleeping, they die of overwhelming infection, presumably as a dysfunction in the immune system. And we need it for the body to just readjust. Because when you enter sleep, your temperature drops, your blood pressure drops, your pulse drops. It's a whole time of relaxation for the body. It allows it to return to homeostasis. Now, what types of things can worsen sleep? First and foremost, you need to think about medications. And okay, there's a list here. I'm going to go through it very briefly. But just more generally, if you notice a change in anything that happens to you medically, and think about it. Oh, did somebody just give me a new medication? Maybe that could be the case. Some medications that can affect sleep, antidepressants, and they can go both ways. Some of them can be more alerting, some of them can be sedating, and in any individual, it can actually be the opposite of what's generally reported in the literature. So they can go both ways. Sometimes they can help sleep in terms of treating depression, and sometimes they can cause insomnia. The alpha blockers that one can be on for enlarged prostate can sometimes affect sleep. Beta blockers, this is important. These are often used for high blood pressure, but they can sometimes inhibit melatonin. And we'll talk a bit more about melatonin, and Dr. Lanata mentioned it. So if you find that you're having more trouble falling asleep and you notice that, hey, maybe it coincided with my being put on a blood pressure medicine, a beta blocker, consider whether or not either changing medication or perhaps an addition of a small amount of melatonin may help with sleep onset. The cholinesterase inhibitors, which are used for cognitive impairment, they actually increase REM sleep, but they can also sometimes be alerting. Glucosamine chondroitin can sometimes affect things. And various medications for Parkinson's disease actually can make people sleepy. And some medications, again, will cause side effects that, not side effects directly on sleep per se, but body manifestations that can impair sleep, such as the ACE inhibitors and diabetic. So my take-home point for this is new pill, new symptom, talk to your physician about it. Now, let's talk about factors generally that can worsen sleep. Believe it or not, some sleep-promoting agents, in particular, you really need to be careful about some of the over-the-counter medications, which are often antihistamines. Dr. Lanata mentioned that histamine is a chemical of alertness. Antihistamine will help people sleep. Some sleeping pills can affect sleep architecture and result in impaired daytime functioning. There are cases where they are helpful adjuncts to treatment, and so I don't mean to cast aspersions on sleeping pills completely, but in general, it is helpful to try to see if there are ways to be able to promote sleep without the use necessarily of sleep promoting medications. Stress, stress, stress. Let me tell you, the pandemic is just wreaking havoc on everyone. Pandemic, what's going on in the nation more generally, it's hard to sleep. It just is. Medical disorders, in particular heart failure and emphysema, people's schedules. I hope you are all enjoying Zoom immensely. I hear about people taking classes all over the world. Personally, my Zumba studio is right outside this door, and I can exercise with my good friend in Boston. And we are just doing an incredible amount, and we can 24/7. And so sometimes one has to sort of watch and make sure that schedules are not interfering with it. Are they being too active or being too active late in the night? And if you guys want to talk about menopause, let me tell you, yes, that definitely affects sleep in just about every access available, both in terms of the physiologic effects from the hormone changes and menopause stress, those like to live together. Okay, let's talk about sleep disorders, which do tend to increase with aging. Okay, obstructive sleep apnea. Yeah, spend a lot of time with this. About 66% of adults over age 65 will have symptoms. The primary one, snoring. I really like to hear about unrefreshing sleep, because that also can be a main key to snoring, and in particular in women. Women, yeah, they will snore with sleep apnea, no question, but it's not necessarily loud. It's not necessarily often. Their primary complaint is going to be unrefreshing sleep. Awakening, gasping for air, daytime sleepiness, and witnessed if somebody sees you not breathing during the night, yeah, that's an important clue. And again, these numbers here, this is, the range can go as high as 70% in men over 60 and 56% in women. My favorite disorder, restless leg syndrome. It is the experience of restlessness in one's legs, the urge to move. It can be, people will describe ants crawling, electricity, my legs are jumpy. It tends to be relieved with motion, but it comes back when people stop moving, and it tends to be worse at night. So you can see how this is quite the combination of symptoms that will make it harder to sleep, and it becomes more frequent with age. If you have it and if you feel it's disruptive, please come see us. If it's intermittent, rare, you probably don't need treatment. But if it's happening a few times a night, it is worth seeking treatment. There are medications for it, and in particular, iron is turning out to be a mainstay both in the pathophysiology and in the treatment. REM sleep behavior disorder. So it's, Dr. Lanata mentioned it, acting out one's dreams. So as he mentioned, during REM sleep, we are generally paralyzed. That's why we don't act out our dreams. And what happens with RBD is that the REM-related paralysis gets taken away, and so people can. There is also a tendency for the dreams to get more violent, and so it tends to present more in men. Women often have less violent dreams, actually. So although they have it, they present somewhat differently. And it was very interesting because the very first case is presented in Minneapolis, and the particular people were embarrassed because the complaint is, doctor, I'm choking my wife. And so when Schenck and Mahowald heard about this, they thought, they didn't know, they actually figured out what it was from some earlier studies in cats, but the greater point was that they put an ad in the newspaper, and all of a sudden all these people came out of the woodwork because they were too embarrassed to go to the doctor. Imagine what it sounds like to say you're choking your wife. But part of that happens because the dreams tend to turn more violent, and as Dr. Lanata mentioned, it is often associated with Parkinson's disease, either as the first symptom or co-symptom, and so it is very important to seek medical evaluation. I'm going to go through this very quickly because I want to get to some more things, and I want to try to shorten my talk. Sleep and dementia behavioral treatments are very important. I'm going to emphasize light out of bed. Melatonin is controversial, and it's a toughie. As Dr. Lanata said, melatonin is involved, and yet the data don't back up its efficacy, but it's a hard one, and perhaps we can address that during the Q&A. I want to talk about how to promote good sleep. Good sleep habits. If you get nothing else from this talk, there are a couple of points I want to make. Get out of bed at the same time every day. Get out of bed at the same time every day. I'm going to go through some physiology that Dr. Walsh will also go through. So I'm going to go through that slide super fast. Get out of bed at the same time every day. Get sun exposure. Go for a walk in the morning and avoid naps. Okay. No caffeine afternoon time. I'll explain why in a second. Dr. Lanata did address it. Restrict fluids for obvious reasons. You don't want to be peeing during the night more than you actually have to. Alcohol, I'm going to emphasize that. Avoid it 3 hours before bedtime, and nicotine can be alerting. So don't do an alerting substance near bed. Go to bed only when sleepy. Keep the room quiet and dark. Avoid screens within 2 hours of bedtime. Again, let me explain that, and keep pets out of the bedroom. This is the summary. We're going to go through this in a little bit more specifics. And now we're going to address some of the actual science behind it. There are two processes that allow us to sleep at night. One is the biological clock. It literally gates. When is it easy to fall asleep? The gates open. Whoop, gates closed. Hard to fall asleep. Okay, this is the, pardon me, because my slides are over, my cursor's over here, so I have to turn my head to the side. This is the circadian drive for wakefulness. So I actually want to start here. This is around 10 o'clock at night. The gate was closed. Whoops, gate opened. Now, why did it open? This is actually melatonin rising. Gate opened, yay! This is drive for wakefulness. You can sleep right here. Whoops, gate closed. You can't sleep. So it's kind of like an on-off switch. Now, this, that is process C, circadian. Process S is that the longer you're awake, the more of the sleep-promoting agents rise in the blood. Adenosine, caffeine is an anti-adenosine drug. Prostaglandins, mediators of the immune response. So your propensity to sleep gets highest at night because the wake-promoting agents, adenosine are highest, and the gate opened. Okay, what regulates the biological clock? Our biological clock is 24 hours and 15 minutes in periodicity. Hey, that's longer than a day. It has to be realigned every day. What allows it to realign? This guy, when you see morning light. So some people like to go walk in the mall. May I make a suggestion? Park your car a few blocks away, get that morning sun. A half hour of morning sun helps to consolidate your biological clock to say, hey, this is when we want to wake up, not 15 minutes later tomorrow, now. So getting it within the first hour and a half of wakefulness. Do not stare at the sun or you will go blind, but do not wear sunglasses or you won't get that nice light on your retina. Cloudy days are fine. Again, regular wake time. Get sun exposure. It will make it easier for you to sleep at night. Caffeine, it is a wake promoting agent by being an anti-adenosine drug, so try to avoid caffeine afternoon time. People metabolize it at different rates, which is why we're so strict here. Now, restricting fluids and food 3 hours before bedtime, alcohol. Guess what business is doing really well in the pandemic? Okay. Wow. One of them is thriving. So, yes, alcohol makes you sleepy. We know that. What happens when it wears off? There's a paradoxical alerting effect at night. So it results in subsequent sleep fragmentation. So don't increase the alcohol at night. It really will worsen your sleep. It suppresses REM sleep. It results in sleep fragmentation. Avoid alcohol at least 3 hours prior to bedtime. And don't increase the amount because then it won't be metabolized until too late. Do not smoke within 6 hours of bedtime. Again, go to bed when sleepy. Keep the room quiet, dark and cool, avoid screens. Now, we talked about why do you want to avoid screens? This is me in my UVX blue light blocking goggles. These are UVX blue light blocking goggles, by the way. Why do we want to avoid screens? We want to avoid screens because the light, which shuts the gate, also prevents melatonin from being secreted. What opens the gate? Melatonin. You need melatonin to get secreted, so you want to avoid blue light during at night. The nighttime blue light blocking settings on your personal screens probably are not good enough, so I would suggest if you're going to use screens at night, add the UVX blue light blocking goggles. Okay, keeping the pets out of the bedroom. There was a lot of pushback on this. This is Bruno. He was the best dog ever. Anyway, the idea is that animals can wake up earlier. They may want to jump on the bed, off the bed, etc. On the other hand, they are a great source of support. So you know what? We make a lot of recommendations. Sometimes they do need to be adjusted individually, but this is one of them. Okay. This is a sleep log. This is when this person was sleeping, 11 to 1, 4 to 8, 10:30 to 2:30, 5:30 to 7:30. What do we have here? We have donut hole sleep. Okay. Hold on. There we go. Sorry. Consider it do not hole sleep. Now, getting back to this, why did the donut hole sleep occur? It started to occur because this person spent too much time in bed. So what happens is you don't actually get extra sleep. Rather, your sleep gets broken up into 2 different sections, and then you have this long period of wakeful worry, and that is incredibly annoying. So we want to get rid of that. Spend only your total sleep time plus 30 minutes in bed each day. Emphasize a regular wake time to avoid the donut hole. Now, if you're falling asleep in the evening, listen to your body. Maybe you are going to sleep earlier. It's okay. It's not a problem. But if you feel it is too early, get up. Do some light physical activity. Try to get outdoor light exposure then in the evening if you want to stay up later at night. So again, good sleep habits, same time every day, avoid naps, get sun exposure in the morning, no caffeine afternoon, restrict fluids, avoid alcohol, blah, blah, blah. Keep it company. I'm sorry, I'm trying to rush to make up the time. Avoid screens within 2 hours of bedtime. Keep pets out of the bedroom. What can you do? Keep track of your sleep schedule. How is your sleep hygiene, which is what I've been talking about, your habits. Consult a sleep specialist, though, under these conditions in particular: snoring and unrefreshing sleep, urge to move your legs at night, and acting out your dreams. Okay, guys. Yeah, I think I made up the time. All right. Let me stop sharing my screen. I think we go to the Q&A now, right?
That's right, Dr. Zach. We got a lot of good questions coming in for you and Dr. Lanata. For Dr. Lanata, one is what else can we do to keep our lymphatic system healthy other than sleep?
I haven't come across much around what other factors actually. It's such a relatively new area of study. The links with sleep are coming up a lot in everything that I've read. But I don't consider myself an expert about the lymphatic system, frankly. I don't know if Dr. Zach has come across any other factors that improve. I see it as related, to general health, first of all, and secondly, specifically to sleep health.
I want to second that. This is a really new concept. And so we don't know, other than we know the aspect of sleep.
Yeah.
Okay, and we have one asking about if the TV screen can affect melatonin, and what about cell phones, holding a cell phone to your ear or sleeping with one under your pillow?
I can comment on the television, definitely. I mean, that's also, I think the idea here is that the better we become at avoiding strong and lights during the evening hours, especially as we get closer to sleep of any kind around the house, the better off we'll be in terms of promoting our natural circadian rhythm and promoting sleep. And I think the greatest offenders around the house are screens in general. You know, it used to be that we only had TVs as a main screen offender. Now we have, you know, maybe iPads, desktops, telephones. So we're kind of bringing in more screens into the night, and that's affecting sleep, I think. I'll let Dr. Zach comment on the other question, the other part of that question.
Yeah, no, I want to second everything you said. I spend a lot of time telling people to get off their phones, off their iPads, to the point, I mean, I'm not the first person to come up with this term, iPad insomnia. A lot of time. And then they say, well, I didn't use it last night. It didn't make a difference. And I'm like, well, maybe you got to do a couple nights in a row here. We got to go, you know, you need to give it habits some time. But the point is, super, super common. And I know when I start playing games at night on my iPad, I'm going to have a bad night's sleep. Okay. I admit, I also do it. But it absolutely, there is no question. And actually, I want to take this one step further, which is when we are using these personal screens. So there's the blue light issue, right? Fine. The other thing you're doing is it's very hard not to be clicking on something, okay? Whether it's your email, whether all of a sudden you saw something interesting and you want to Google it. And the process of clicking on these different sites and going back and forth is increasing adrenaline and it's increasing dopamine, and these are chemicals of alertness. So you're actually getting a double whammy. You are inhibiting the biological clock from doing what it's supposed to do, which is to open the gate and let you sleep, and you're increasing wake promoting factors that are going to work against your sleep. So as a wonderful, dear mentor of mine who unfortunately has retired, we have to get Kathy Lee back into practice. So if any of you know her, just send her emails and tell her she can't retire, she has to go back. What Kathy suggests, she was actually the associate dean of research in the nursing school, and she actually was a pioneer in women's sleep and in getting women as subjects in research projects. Just a historical aside, but what Kathy says is she suggests read the comics, get a newspaper subscription, read the comics, no blue light, it's not going to irritate you. And again, that clicking is another problem that happens.
Yeah. And I just want to also say that, you know, now you can buy like little like bed lights that screen out the blue light. So you can have only like yellow hues, and that also promotes sleep. And I have some patients that, you know, they wake up in the middle of the night because, you know, they have one of these normal wakefulness periods, but now they're very aware of them. And they feel like, oh, here I go, I woke up again. And rather than, you know, trying to just go back to sleep, they turn on their iPads and they just feel like, oh, I'm just going to get distracted by reading my email or something. And unbeknownst to them, they're like activating again the whole light cycle, and that puts them in trouble.
Yeah, actually, can I just second that? That there's in insomnia therapy, there's something called stimulus control, where you don't lie in bed awake, you get out of bed and do something boring in a chair, fine. But one of the things is you don't want to be flipping on lights. And so to use these things, these lights that don't have blue lights or little tiny things, or night lights on the floor so you don't trip on the way to the bathroom, but you also don't put a lot of blue light on your eyes when you have to get up in the middle of the night, which is quite common.
Great. And then we have a question. Is there any genetic characteristics to the different lengths of various sleep stages? Is there a lot of variability person to person?
Maybe Dr. Zach can take that one.
Depends which. I'm going to answer a different question. Okay. Well, I'm going to say I don't know. It is normal, and it tends to be somewhat invariable that your sleep cycles that alternate non-REM and REM, non-REM and REM, end up changing in the progression that both Dr. Lanata showed and that I showed, where you end up with most of your non-REM in the earlier cycles and most of your REM in the later cycles. That tends to be fairly consistent, although I will say, actually, depression changes it. And with depression, people tend to have their REM earlier, and it tends to be the same amount throughout the night without this variability in terms of duration. But I will answer that in terms of circadian rhythm, meaning night owl, morning lark, those are clearly genetic, and there are genes that are being explored for various ones, with particular emphasis for the people who are morning larks from day one. There are well-defined genes that were actually done at UCSF with Louis Patatchik's lab and our wonderful colleagues there.
I want to make a question, actually, a follow-up question for you, Dr. Zach, since there's a lot of, some commercial labs now are claiming that they can tell you, they can make genetic-based comments on your ability to metabolize caffeine. I don't know if you've come across these companies, and I wonder how much good science there is around this, because, frankly, I do meet patients that tell me, caffeine doesn't do anything to me. And I'm always wondering, are they just habituated to the effects because they've been taking it so long that it's part of their normal, they normalize it? And like I said during my talk, I have met some patients that, after much discussion, they test it on themselves. They just come out the caffeine in the evening hours, and that does help. So I'm wondering what you think about caffeine metabolism.
Both and. Always a good answer to any question, both and. But I do believe so. I am sure that there are people, everybody's brain is different, right? and their neurochemistry is different. So I am sure that there are people for whom the caffeine doesn't make a difference. But I also think there are people who, because they are habituated to their current state, do not realize that it is an alteration induced by a substance. And we see this not just with caffeine. I also want to emphasize alcohol. Oh, no, it doesn't affect my sleep. No, I've gone off it, didn't make a difference. Sometimes you have to be off it for a month. Oh, that's when my pile's falling. Okay, I've been called out. I'm a hoarder. But really, sometimes you need to go off the substances for literally a month to really start to rebalance the neuroreceptors, et cetera, and see a difference. So I do think it is both and. I am sure there's some people out there, but I also think people are not aware. And can I just add, actually, it's an important thing that sometimes we see that with restless leg syndrome. I will catch it in patients who come in. That's not what they're coming in for. But they've had, they'll come in for sleep apnea, but they've had their RLS symptoms for so long that it doesn't feel like it's a disturbance, because it's normal that they have to kick for an hour before going to bed. So I think perception and habituation can play a role.
Great, and we're getting a lot of questions about melatonin, suggested dose, any negative side effects. Are there any other supplements that aren't harmful that can help with sleep?
Actually, Dr. Lanata, I'd like to hear your take on melatonin and sleep in dementia, and I will gladly also put my perspective on that question, but I'd like to hear what you have to say.
Yeah, I think this is an area that I think as dementia specialists, they say we don't have a homogeneous and practice around this. I think some clinicians take the perspective of, looking at these studies that show that even in Alzheimer's disease, what can happen is that the disease itself can attack the hypothalamus, can change hypothalamic dysfunction, and therefore some clinicians see it as a way of supplementing the hypothalamus by just recommending that people take some melatonin in the evening hours. Other clinicians I see, what they do is they just use it as a treatment of a symptom, right? And not so much basing it on underlying biology. They're thinking, well, if you're having trouble falling asleep, not so much staying asleep, but falling asleep, then melatonin could be helpful. In terms of dosages, I think that's where it's like all over the map, because I feel like I've seen some papers that actually recommend starting at a very low dose in AD, like even 0.5, 1 milligram, but then other clinicians are starting at a higher dose. They go like to 2 milligrams as a starting dose. And then you go up to 6 milligrams, up to 8 milligrams even, as tolerated, and until you reach the desired effect. And the other part of this is that melatonin, there's some studies also that suggest that it can be beneficial for treating migraines. So it's being used in the migraine specialty clinics in a different way, meaning much higher doses. So it's a little bit confusing, frankly. I feel like what I do personally is, if I have a patient that is in sort of moderate stages of AD, Alzheimer's disease, and is having sleep-wake dysregulation, I see it as a potential way of trying to normalize as much as we can the normal sleep-wake cycles. And I think my starting dose generally is around 1 to 2 milligrams. And then I just go up depending on how the patient feels, but not very much evidence-based, I think.
And I actually sort of want to second that the evidence base is hard. The evidence base is hard because who's going to pay for it? Okay, once something's over the counter, forget it. That's number one. I tend to actually start a little lower. I actually like the 0.5 milligram dosing because you don't need a lot of melatonin to get to physiologic and above physiologic levels. I do see though that people will go much higher, as Dr. Lanata said, go higher based on symptoms, and with some success. You should be aware there are multiple melatonin receptors. There are those that regulate the biological clock and those that help promote sleep. And so timing sort of depends on those. Often we generally recommend it a couple hours before the desired bedtime because you want to have it do this kind of thing, similar to the curve that I showed you earlier. In terms of side effects, again, this is the problem. You don't have great data. There is concern about its inducing depression. And too much of anything I think is a problem, but really, again, starting at a very small dose, I think is the most judicious. Stay at that dose for a minimum of a week. Go up by a half, by a quarter, but a lot of people start at 5 and then they go to 10 and then they go to 15. And I will tell you, for REM sleep behavior disorder, absolutely. I have patients on 15. That's different. I'm treating something very different and very specific. I don't think one generally needs 15. And I want to add to it that evening melatonin and morning light are kind of like doing similar things at opposite times. So in particular, if you have friends, relatives who are not getting, nobody's getting out now, but getting that morning light is huge. There are light boxes one can get. There are these little glass things you can put over. But when this all clears, getting people up and about is probably the most effective thing. That morning walk is huge. And look, we live in paradise. Yeah, it's actually raining right now, not where I am, but up in Marin. But most of the time, we can go for morning walks. And again, masked, socially distanced. But if you can, I think that really helps with insomnia.
Okay, great. And a question I think that could go to either doctor. How can one recover brain health after years or any duration of sleep issues?
Good question. I'm trying to think of how to answer that. Again, ruling out sleep disorders such as sleep apnea, too much blue light exposure that's preventing consolidated sleep by preventing the melatonin secretion. I'm not sure there's anything you can do other than getting rid of those contributing factors that are fragmenting sleep.
Right.
It's not like, actually, exercise is good. It's good for sleep. It's good for the brain. But yeah, exercise. There you go. Will that compensate? I don't know. What do you think, Dr. Lanata? I think exercise is good.
I think this question touches a little bit on the concept of brain plasticity, right? That and people, which is true of any brain disorder, any brain disease, even people that have a stroke, that initially feels and looks like it's a devastating stroke, there is an underlying concept of brain plasticity, meaning the brain's ability to recover, that is clearly there. And that's why I say, you know, every person that survives a stroke is gonna have signs of improvement over time, and that can last a really long time. So if you've had years of sleep disruption, either through a specific sleep disorder, or maybe not diagnosed sleep disorder, but you come around and start to address it, I think you should expect that, you know, you're going to recover your circadian rhythm, you're going to recover your normal sleep wake cycles, and you're going to improve, because the brain is very resilient like that. And so I think it's never too early or too late to address these issues.
Great. For Dr. Zach, regarding the daily sun, is it the vitamin D that you need? Do you actually need to be outside or just see the sun, and for how long?
Thank you. I should actually put in a very specific slide about that. I appreciate the question. Okay, it is the light going onto the retina. Okay, it's getting light on your eyes. It's not the vitamin D. Vitamin D is very good for you. You need to have good vitamin D levels. That's not what it's affecting sleep. It's the light on the retina that resets the biological clock so that your melatonin will get secreted at the right time that night. You need 10,000 lux for 30 minutes. Why am I giving you that? You need 30 minutes. So going outside, you're going to get way more than 10,000 lux. So just getting outside will solve the problem. You need it fairly in the morning. In other words, the closer you are towards lunchtime, the less effective the dose. So we generally say within the first 90 minutes of wakefulness. 30 minutes, first 90 minutes of wakefulness. I'm telling you the 10,000 lux because if you can't go outside, sit near a really big window, or there are these light boxes, light visors, etc., and you would want it at 10,000 lux, and each device will tell you how to get that.
Very good. And then a couple questions about natural treatments like passion flower for quality of sleep, or almonds, taking almonds at bedtime. I think they recently read that almonds have a small amount of melatonin in them.
Oh, I have no idea. Did you know they have melatonin in them?
No, I didn't. I think that the just broad comment I would make about dietary supplements, right, in general, is that these are substances that are not regulated by the FDA, by the Food and Drug Administration, before they're put out on the market. So the FDA will only intervene and regulate these substances when there's a reported serious adverse consequence, right? Toxicity of an organ, or even death, or things that are serious. They will not intervene if a substance goes out in the market and, you know, and it's not doing anything harmful, basically. Then people can continue to sell it. So you have to be mindful of this when you read about or hear about these supplements. And, you know, they advertise them very well, but most often they are just not backed up by any form of, you know, scientific study, or even sometimes common sense. Usually, sometimes these products go out because there was like one animal study that suggested something in a cell culture, maybe, or something like that, and they just extrapolate to a whole organism, to a human, and they say, well, it's not going to harm anyone, so let's just put it out of the market. Somebody's going to buy it, and that's frankly what's happening. Many people are just out there looking for easy income, frankly. So you have to be extra careful. I think what I tell my patients is, you know, if you're curious about a supplement, we can talk about that one individually. I sometimes will already have known something about it that I can share with them. Or if I don't, my primary, I think, goal as a clinician is to make sure that it's not harmful. And then make it very clear to them that, you know, you're experimenting on yourself, and I'm not gonna force anyone not to buy anything, right? We can't do that. And some patients feel, you know, my neighbor is taking it, they feel it helps. Well, what can I do? I can't argue against any of that. So I just would like to just highlight these things about supplements.
Great. Thank you so much, Dr. Lanata and Dr. Zach, and thank you everyone for your questions. We will have another Q&A session after the next two talks as well. And for now, I will pass it over to Ola to introduce the brief break.
Great. Thank you, Eiley, and thank you both Dr. Lanata and Dr. Zach for your wonderful presentations. I'm going to go ahead and share my screen for the break. So this will be a 5-minute break, so feel free to return around 11:05, 11:06. I'm going to go ahead and also play some relaxation music just to, get people in a relaxing mood, and we'll see you back around 11:06. Hi, everyone. Welcome back from the break. I hope you all enjoyed it. Next, we are going to have a talk from Dr. Walsh. And Dr. Christine Walsh is an assistant professor at the UCSF Memory and Aging Center. Her research focuses on sleep and rest activity rhythms and how they are associated with neurocognitive health across aging and neurodegenerative processes. During shelter in place, Dr. Walsh is continuing her research from home with the support of her lab group and her 3 young children, who she hopes will not make an appearance during this session. Dr. Walsh, the floor is yours.
Thank you, Ella. Okay, so thank you everybody for coming to hear about sleep today. I know it's something that is steadily on all our minds, especially during shelter in place. I'll be talking about how to sleep your way to a healthier you, or the areas that are often affected by sleep disruption. I want to give a quick shout out to my lab group. This is the Sleep and Aging and Neurodegenerative Disease program. So this is during one of our Zoom lab meetings in the past week. I'll be talking briefly, because I know you've already had some of this in the previous 2 lectures, but we'll talk about sleep and circadian rhythms in general health, sleep and cognitive health, sleep and brain health, cardiometabolic health, diet, pain management, immune health, mental health, and social interactions. And the main take home is that sleep disruption can affect all these factors, and similarly, these factors can disrupt how well we can sleep. So it's this finding this gentle balance between these factors. And so Dr. Zach in particular was talking a lot about circadian patterns. So when we look at the y-axis, this is the pressure to fall asleep. So we're starting to feel really tired the higher we are on this y-axis. And the longer we're awake in white, we become more and more sleepy. And so there's more pressure to fall asleep. And then when we fall asleep, we recuperate this feeling. And if we remain awake, it stays up. And naturally, this has a cyclical pattern as we sleep. And so this is our sleep-wake patterns affecting how we feel. And then on top of that, we have our natural circadian processes. And in an older adult population, a disrupted circadian cycle can predict progression to mild cognitive impairment 5 years later, and impaired executive function in particular 5 years later. And we've seen that shift workers have increased risk for cardiometabolic disease, obesity, hormone dysregulation. A lot of this is because they are up and active and awake in a misaligned fashion with their circadian rhythm. So their general physiology is pushing them to be asleep and expecting them to be asleep, but their work is social caregiving and other factors are keeping people awake during the night. There's an increased risk of stroke in individuals who have disrupted circadian rhythms, as I just mentioned. And these strokes typically do occur early in the morning, so they can also have a circadian factor. And shift workers do have increased likelihood for diabetes and cardiovascular disease, even controlling for increased weight. But it's not all bad news. It's not across everybody who shift works. And these are not genetically based night owls versus morning larks, but using the more traditional terms. So those people that shift work and are typically more night owls, more awake during the night, or tending towards being awake at night, their BMI is increased. However, in the people that like to wake up early, and those shift workers tend not to have the same increases in their BMI. So your natural circadian type can influence how disrupted your physiology is when you're doing shift work and your sleep-wake misaligns with circadian rhythms. And during COVID, of course, all these things are being affected. And with the restrictions due to shelter in place, many people do have a shifted sleep cycle where they're going to bed a bit later. Some of the research is suggesting like 41 minutes. It's very precise. And they're waking up later as well. So they're going to bed later, waking up later. And overall, there's a longer duration of time that they're actually in bed trying to sleep and are actually asleep. However, that does not necessarily mean that we're having better sleep, but we are spending longer asleep. Not everybody, but quite a few people. So it's possible that with some of these shelter-in-place restrictions, that people's patterns between their sleep-wake patterns and their desired circadian rhythms can become more aligned. And some of that's because we have less pressure to make a commute or to be at a set place. The doctor's appointments are now over Zoom, so you don't necessarily have to be up an hour ahead of time to get there. You can be up, brush your teeth maybe, and sit in front of your screen ready for that doctor's appointment. So social jet lag shifts in sleep timing. The social sleep restriction is the difference in sleep duration between your work and your free days, or your weekend and the typical weekdays. And both can negatively affect health, mental well-being, and performance. And when we look at in this kind of pink color, this is before lockdown or before shelter in place, and orange is during shelter in place, we can see that there is a shift where there is less social jet lag, there is less social sleep restriction, sleep duration has marginally increased, but unfortunately the sleep quality has not necessarily improved. It may have actually diminished slightly. And this depreciated or reduced sleep quality seems to be mostly related to those individuals who have increased self-perceived burden. So the message for those individuals in particular is to try to increase your exposure to natural daylight and physical exercise early in the day, again, echoing what Dr. Zach talked about. Next, I'll talk very briefly about sleep and cognitive health. This is an extensive area, but we'll just touch on it briefly. So both healthy sleep and circadian rhythms are important for general health. And the function of sleep is protective. It acts to conserve metabolic energy and to restore it. So you're using less while you're asleep, but you're also building your resources back up for the next day. Sleep helps you to thermoregulate and potentially in heat retention. It helps to regulate your hormone release, including those hormones that help us regulate our appetite and control our sugar balances afterwards, our insulin. Helps us to regulate our immune system, assists with cognitive and mental health. And we know sleep is important because when we don't get enough, we sleep rebound. We oversleep to try and recuperate from our lost sleep. In younger adults, they did describe that 14 days of 6 hours of sleep at night, so just slightly reduced sleep, can be equivalent on cognitive tasks to 2 days of complete sleep deprivation. So short sleep can be a bad thing, but so can long sleep. So long sleep, so sleeping too much, can be an indicator of cardiometabolic disease, depression, cognitive impairment. And in individuals who napped for 60 minutes a day were more likely to develop Alzheimer's disease 5 years later if they carried the gene that increases your likelihood, does not guarantee by any means, but increases your likelihood for developing Alzheimer's disease. But in those individuals with that gene that did not sleep more than 60 minutes a day, they did not go on to develop, or they had much less of a likelihood of developing Alzheimer's disease. Sleep and cognition in healthy older adults. So long sleep durations are associated with poor global cognitive functioning, in particular verbal fluency, memory recall, things like that. Short sleep durations, some mixed findings in this area, but overall, when you sleep for 5 hours a night, you have poor global cognition. And this in particular is being seen in the memory and executive function areas. And when there was a study done to say, okay, in the past, how long did you typically sleep for? They did find that those that reported prior long or short sleeps had worse cognition than those that were more in between sleeping. And in individuals with mild cognitive impairment, the longer time it takes to fall asleep in bed, it was associated with impaired memory. And in a study I really like, they were able to show that sleep disturbances can modulate a diagnosis of mild cognitive impairment. And for this study, they looked across 2 weeks. Each day, an individual was assessed for their sleep the night before and for their cognition that day. And the days that people slept better, they had a diagnosis of healthy older adult. And in the days following the nights of poor sleep, then they got a diagnosis of mild cognitive impairment. And in general, we understand that poor sleep can lead to cognitive impairments, and the cognitive impairments, similarly, as we're developing different neurodegenerative processes or medication-related cognitive impairments, that they can disrupt our sleep. We all are familiar with the term insomnia. So insomnia is referring to people who have trouble falling asleep at the start of the night, people who wake up too early, or people who have sleep disruption in the middle of the night, or can be a combination of any of those factors. And in older adults, insomniacs have been shown to have worse working memory, worse executive function, so these like higher level thinking tasks. But on the simple tasks, simple reaction tasks, they can actually attend a bit better. But as soon as those start getting more complicated, they start swinging into having worse performance than the non-insomniacs. However, it's typically those individuals with early morning awakenings who had the worst executive function. And that's compared to those that had disrupted sleep in the middle of the night or took longer to fall asleep at the start of the night. And that difficulty, therefore, falling asleep or staying asleep in some of these studies have no cognitive impairments for executive function, visuospatial ability, attention, or even verbal memory. So it's really trying to maintain your sleep. Now, if you're an early morning waker and that's naturally your timing to wake up, this does not pertain to you. It's that if you wake up and you still are sleepy, you still need more sleep, this is related to you then. We'll talk briefly about sleep and brain health. So here we're looking at a brain, and on the outside we have the gray matter and the inside is the white matter, so communication between different brain regions. And we see that shorter sleep duration is associated with smaller volume, so less volume, less healthy brain. In total, gray matter, so all on the outside. White matter, so there's possibly fewer tracks or more broken tracks for communicating information between different brain regions. The hippocampus, which is important for learning and memory, can be smaller with shorter sleep durations. And the thalamus, which is important for a plethora of physiological regulatory mechanisms, is also decreased. This has not been looked at yet in long sleepers. So this is specific to shorter sleepers. And even subjective sleep, so not looking at objective sleep. So how you feel you slept, for those individuals reporting more sleep fragmentation, so more broken sleep during the night, that fragmentation was able to account for quite a lot of the volume differences between people in these general hippocampal areas. So again, your learning and memory area. And the poor sleep quality is associated with poor white matter microstructure integrity. So again, thinking about having leaky neurons or not being able to transfer the information as fast or as cleanly between areas. A postdoctoral fellow right now is working with me, and she's finding that when looking at insomnia severity, you can actually see differences within cortical thickness, so how thick different brain regions are. And this is tied to how severe, even on the milder areas. So none of these are severely insomniacs. They are mild to moderate insomniacs. And we can see volumetric differences. And in another study by Marie Altendal, who's now in medical school and proceeding very well, she worked with me to see that REM sleep is associated with how healthy your white matter is again. And the higher on this y-axis, the healthier your white matter. So the more REM sleep you have, the better your healthy white matter is. Looking at cardiometabolic health and diet. there's an increased risk of cardiometabolic disease with sleep disturbance, and this is both sleep quality and sleep duration. Coronary heart disease is associated with insomnia, and insomniacs are more likely to have recurrent cardiac events. What I found recently interesting was that insomnia in females put male bed partners at risk for heart disease. So it's not only yourself that could be affected, but it's also your bed partner. And cognitive behavioral therapy for insomnia is effective in reducing insomnia in individuals with coronary heart disease. And while many therapists right now are providing something that they call CBTI, so this cognitive behavioral therapy for insomnia over Zoom, there's also several online programs that you can be referred to as well, so that you can basically do this in your own time and try to take advantage of some of the online resources currently available. Exercise to sleep. So you've heard a lot about exercising right now. So confinement without moving around can disrupt your sleep patterns the next night, and daytime exercise improves sleep as long as it's not too close to bedtime. And so many of us, again, have disrupted routines during the shelter in place. And some of these disrupted routines include reduced exposure to light, which then leads to disrupting our sleep-wake cycles. And the home confinement was associated with waking up too early or difficulty falling asleep. However, luckily, some older adults seem to be protected against some of these shelter-in-place factors. And the individuals in particular who have sleep-disordered breathing and use a CPAP reported fewer sleep difficulties. So being mindful of, if you have a CPAP at home and it's been sized for you, do try to use it and stick with it, because it may alleviate some of the shelter-in-place sleep disruptions occurring. Sleep and diet. So anytime you've been up late the next day, what kind of food is your body craving? So those who sleep less than 5 hours drink more sugary, caffeinated drinks, trying to give yourself the boost, but your internal physiology is driving you to select more of these sugary items as compared to this healthy rainbow of good food for us. And so your body is searching for that sugar and fattier food in those that have more sleep disturbance, and less in those that are sleeping better. And unfortunately, at the same time that our body is craving specific unhealthy food, your sleep disturbance decreases your insulin, so your ability to regulate your sugar intake, and increases your ghrelin release, which increases your appetite. So you're eating more, it's more unhealthy, and you're no longer able to regulate it the way that you used to with this sleep disturbance. If you sleep better, your insulin and ghrelin levels can kind of rebalance, because you're getting that good, healthy, deep sleep. So try to keep a stable sleep pattern as much as possible. Greater sleep irregularity is associated with a 10-year risk of cardiovascular disease, greater obesity, increased hypertension, fasting glucose levels increased diabetes status, and perceived stress and depression. Next, we'll talk about pain management and the immune health and how those are affected with sleep. So lack of sleep is associated with increased pain sensitivity. And chronic insomnia is associated with chronic pain levels. So the less sleep you have, the more increased pain sensitivity you have. But similarly, the more pain you have, the harder it is for you to sleep. And coming back to this cognitive behavioral therapy that I mentioned earlier, it can help reduce the occurrence of migraines. And similarly, if it's done to target insomnia and pain, it can alleviate both. Immune health. So how can we boost our immune system? Sleep well. Not too much, not too little, just the right amount for your particular physiology. So sleep is associated with maintaining the ability to launch an immune response, to decrease the risk of infection, improve your response to vaccinations, improve the outcomes as a result of infection, and your immune responses can increase sleep duration and disrupt sleep quality. So In other words, after you get a vaccine, for example, it's good to try to sleep regularly. Don't pull an all-nighter, but it's also, it can cause you to sleep a bit more because your body is fighting or launching a small immune attack to combat, to build your antigens against that vaccine to help it work. So poor sleep is associated with increased chronic inflammation, and that inflammation is part of the immune system, can lead to diabetes, atherosclerosis, neurodegeneration, and increased stress response in general. So poor sleep can affect your immune response, and similarly, your immune response can affect your sleep. Looking at sleep and mental health and sleep and social interactions. So poor sleepers have increased inflammation, which can lead to increased responses to acute stressors. So this can increase your anxiety and your depression. And a prior diagnosis of insomnia can lead to PTSD in a high stressful situation. So this is basically saying that if you've been previously told that you're an insomniac, you could have a increased likelihood of still being an insomniac and sleeping poorly, which could lead to a greater response to a stressful situation and leave you predisposed to PTSD, so post-traumatic stress disorder. And unfortunately, post-traumatic stress disorder does worsen with sleep. And what we've seen is that poor sleep prior to a trauma can increase your likelihood of developing PTSD. But similarly, if you're exposed to a trauma and you have significantly poor sleep afterwards, it can also lead to PTSD. Treatments can include exercise, cognitive interventions, relaxation techniques, or a combination of all of these factors. And in particular at the moment, during COVID and social unrest and the politics going on, no matter what side you are, you need to try to control your exposure to the news, because all of these factors individually can lead to a sense of trauma and increased stress. So just to think about, poor sleep can lead to depression. Depression can lead to poor sleep. Control your exposure to any of these potential stimuli. And loneliness in older adults during shelter in place. So we can all feel a little bit less connected with everybody since we're not able to go out and interact like we used to. But doing things like this is super, so keep it up. So loneliness, increased worry and less resilience can lead to decreased sleep quality. And unfortunately, decreased sleep quality can then increase our sense of loneliness. And so on this graph, if we look at sleep problems increasing on the y-axis, and in the dark line are people who typically worry more or have more worries. And those with the very dashed line are those people that have fewer worries or fewer sense of worry right now. And we can see that it's a much steeper incline for those that have more worries to have increased sleep problems. And social isolation itself can increase sleep disruption. Social isolation is associated with higher rates of depression, irritability, and loneliness, but perceived social support can offset this. It can lower depression symptoms and lower the risk of poor sleep quality. So it's just the perceived social support that can offset the social isolation effects. So during the pandemic, individuals who reported greater social participation and a sense of belonging had better subjective sleep quality. And trying not to feel lonely in itself could actually improve sleep quality. So trying to fight against that sense of loneliness. Being social diminishes stress and improves sleep. And for some people, the COVID-related restrictions has actually increased their social interaction through virtual means. So I now talk to my mom every morning, whereas before it was every few days, and she's on with the grandkids over Zoom or FaceTime all the time. And so her particular sense of social interaction has probably increased due to all the increased virtual means and our flexibility to communicate easier or at a time zone that's best for her. So do think more about how can you reach out, how can you interact with people, even at a distance. Recently released from UCSF by Dr. Sturm, it's this idea of taking an all walk. Does it relate to sleep? No, but I think it's important because it's an easy thing that we could try to do to help improve our mood and therefore our sleep. So the idea of this study was they had an exercise group who was told to go for a walk 15 minutes a day every day, and another group who was told to take an all walk, and during that 15 minutes to pause and look around in the surroundings and just be in awe. And it's easy to find some of these, the exact guidelines that were given. And basically what the take home was that individuals who took the all walk had a better sense of self, a better sense of who they were in the world, felt better about their place in it, felt better about themselves, and were more engaged in both in their surroundings and then mentally up, with lower rates of depression, lower anxiety in general. Whereas those that walked for 15 minutes a day, while it was super and it's really important to go for those walks, they weren't quite as good as the all walk, but they were better than those that didn't take any walk. So if you can, just take a pause when you're out for your walks and look around you. So tips for trying to sleep your way to a healthier you. Do try to maintain stable sleep patterns, especially those tips that were given by Dr. Zach. Follow a healthy sleep hygiene program. Exercise in the day before the evening. Morning is best. Get exposure to sunlight or bright light in the morning. Communicate with family and friends. Try to avoid napping if you can, or at least no long naps. Limit caffeine and alcohol. The Mediterranean diet may help. And take it in steps to try and improve your sleep. Don't jump in tonight or tomorrow and try and do all of this. Take it in small steps, because the main thing is to not try to stress too much about how much sleep am I getting? Am I getting the right type of sleep? Just incrementally pick away at it. If you need help or you have significant sleep disruption, reach out to a doctor, see if they can help as well. I've included a few brief resources that you may be able to look up. I want to thank you all for your time and for your attention. Thank you.
Okay, great. Thank you so much, Dr. Walsh, for your wonderful talk. Next, we will have Dr. Zhu's talk. Dr. Yisham Zhu is a licensed clinical psychologist trained in the Stanford Sleep Center and gained the Diplomat in Behavioral Sleep Medicine, DBSM, certified by the Board of Behavioral Sleep Medicine. She is currently the founder and director of the Mind and Body Garden Psychology Clinic. The floor is yours, Dr. Zhu.
Thank you. Nice to see you all, and thank you for all the great talks by Dr. Zach, Dr. Walsh, Dr. Lanada. And my talk, I will loop back to all the previous talks and just give you all more practical tips and also like explain a little bit more details. So let me share my slides. Okay, you can see it okay, right?
Yes.
Okay, so first I want to talk a little bit more further about the sleep apnea. I think Dr. Zach and Dr. Anada already mentioned that very nicely. Here, just to provide a commonly used self-screening tool called Stop-Ban questionnaire. If you are not sure whether you have sleep apnea or you are wondering some of the symptoms, this is a commonly used tool you can use to assess yourself. And you can find it on certain website. It's really asks about fatigue level, snoring symptoms, and based on your own demographic information, and then give you a general idea. But this is not for diagnose. It's really for understand your symptoms more, whether you should pursue a formal assessment. And this is a website. If you directly go there and enter all the data, the results automatically come out. So if you have sleep apnea, your airway got blocked as the picture shows, I just want to re-emphasize what previous talks mentioned, that if you have sleep apnea, you have this condition, but you are not treating it appropriately, it can lead to some very severe health consequences. And as Dr. Lanata mentioned, like for example, that can increase the risk of getting a stroke, and it can increase the pressure on your heart, and your heart have to work harder when you sleep at night to really get air in. If you have sleep apnea throughout the night, your oxygen level, oxygen saturation rate can be low. So your brain, your heart, your body are just not getting enough air, not getting enough oxygen. That can lead to a lot of health consequences. So if you have any of the symptoms in the screening tool, or for example, if you wake up, feel like dry mouth and all the symptoms Dr. Zach mentioned in her slides, and headache, sometimes cold feet, some of that you're not sure, you can always try to talk to a sleep doctor and see whether you can be referred to, whether you're qualified, whether they suspect that, they can refer you to sleep center for a formal diagnosis. And that's the first picture is what that look like. You're gonna wear all this equipment, all these wears on your body and spend a night in a sleep center and see the result, and the doctors will explain what the result is, what your sleep look like, whether there's any conditions you should be worried about. If you are diagnosed, there are different ways of treatment, depends on the age, the conditions. One common treatment is CPAP. This is just one of the pictures. The mask has different types, a full face mask, half face mask, just the nose piece, whatever works for you and whatever the doctor think is the best for you. So I just want to emphasize sleep apnea. This kind of sleep disorder is not something we can just ignore. So I would encourage you all to pay attention to it and to get the appropriate diagnosis and treatment if you have it. Okay, so for me, mostly because I'm a clinical psychologist, in my clinical work, I treat insomnia the most. So I will spend more time talk about insomnia and how to improve sleep quality in general. So insomnia, this is the common ways to diagnose it. If you have clinical insomnia, then the common symptoms are you either have difficulties falling asleep, staying asleep, or you wake up far too early than what you want, what you normally do. And this have to happen at a certain frequency. And it has to bother you enough to really impair your daytime function. Because some people, they may have these symptoms, but it does not bother them. It does not cause worry, does not cause any disturbance or emotional disturbance, then they are fine. But if it bothers you and it give you a lot of stress and impair your daytime functioning, then when you see a clinician, they can evaluate you, see whether you meet the full criteria for clinical insomnia. But it's very common for a lot of adults, for a lot of us to have some symptoms of insomnia. Actually, under COVID this year, some researchers find the Google search for this term insomnia increased a lot ever since shelter in place happened. And a lot of this search, either to understand insomnia or the treatment for insomnia, a lot of this Google search happened in the middle of the night, like between 12 to 3 a.m. So there's a lot more sleep disturbance, like Dr. Wash mentioned, this year after COVID. So I just want to distinguish a little bit. When we talk about insomnia, a lot of time our anxiety can be really high. If we are not sleeping very well, we may think we are losing sleep. But these two things are slightly different. They are not always necessarily the same thing. Sometimes we can have insomnia and sleep loss at the same time, but most time, a lot of time, they are two different categories. If we have insomnia, that means we gave ourselves enough opportunity to sleep. Actually, sometimes we can create too much opportunity to sleep. We can go to bed early, we'll try to sleep, but somehow we are not able to fall asleep or stay asleep. So that's the sleep ability is reduced. But sleep loss or sleep deprivation is we are busy with other things in life or something gets in the way. We don't give ourselves enough sleep opportunity. We don't give us enough time, space to really allow ourselves to rest, to sleep. We are able to sleep if we go to bed, but we just, deprive ourselves of that. That's sleep loss. And the health consequences are different. Sleep loss are associated with much more like health consequences in the literature than insomnia. So I want to distinguish that because a lot of time we think if I cannot sleep well, I'm not sleeping enough, the certain hours I have in mind, maybe that means I'm losing my sleep. And then I'm very anxious. I want to control my sleep, and that lead to even worse symptoms of insomnia or some sleep disturbance. So when we understand these two things are not necessarily the same and they lead to different health consequences, sometimes it can help us reduce the anxiety of insomnia itself. So a common question I get, which is covered by the previous talks, are also like, what's the difference between sleep quality and sleep quantity? Which one is more important? Like Dr. Lanada mentioned, these two things we should pay equal attention to. Clinically, if we are not sleeping well or if we have insomnia, I want to encourage you to think about, would you rather to sleep like 7 or 8 hours, but it's very fragmented sleep? You wake up often, and even though you try to maintain a super long time, but it's just very like poor quality of sleep. It just, you don't feel refreshed in the morning, but you think you managed to sleep 7 to 8 hours, or you would rather to have like 5 to 6 hour sleep, but feels like it's higher quality, less fragmented, you're able to sleep through most of the night and you feel better in the morning. Just to think about that, which one you prefer, right? So a lot of time when we treat insomnia or when we want to help people sleep better, we really want to focus on the sleep quality first. Even though, and the method of treating insomnia, like the CBT for insomnia method Dr. Wash mentioned, part of that is to help you cut the unnecessary time on bed. If you are on bed tossing around, totally awake, worry about sleep or not sleeping at all, but you're trying to do that, with depending on situation, sometimes we can limit those time and cut it down to make a shorter sleep window, but help you improve your sleep quality first to make sure you have higher quality of sleep, the shorter. And if you can do that night and night and sleep well, then we can start to extend the window and help you sleep a little bit longer, eventually find what's the optimal sleep window for you, which is different from person to person. So in treatment-wise, for me and many other sleep clinicians, we focus on sleep quality a lot. And this, by focusing on this, can really help us reduce some anxiety to let down some control of our sleep also. And a lot of time I get people to ask me, they said, well, my goal for treatment is to sleep like 7 or 8 hours per night. And then if I ask them like, well, when was the last time you sleep like 7 or 8 hours per night, night after night for a while? And some people may say, well, never, or haven't slept that long for a long time, but I thought it's healthy for me, then that is a goal maybe not quite realistic for your own situation. If we can, you know, adjust the goal to something more realistic, like well, based on your own sleep data, if you track your data, like a previous lecture mentioned, you assess your own sleep, you track the data, find out, well, most night I'm actually only sleep around 6 hours or 5 hours, then that's maybe a better start point than aiming for 8 hours. So under COVID, we have a lot of challenges, like Dr. Wash mentioned. So I just want to mention several things that I see often this year. So during the daytime first, a lot of us take a lot of naps. Several doctors already mentioned nap a lot. I just want emphasize that again and talk about it a little more. So napping during the day, I totally understand when we have nowhere to go, we have to stay in the household all day long. And it's very easy, even for myself, to think, well, should I just lay down or rest? And maybe I feel tired, I don't want to do much, I can just take a nap. It's very easy to do, it's more accessible for us nowadays. But I would see napping during the day similar to taking snacks during the day before you have a full meal or full dinner at night. So think about if you eat a lot of snack during the day, either part of the day or throughout the day, then will you be hungry enough at night for the dinner? Maybe not. And then you may not be able to eat a lot on your dinner table. So napping is similarly, if you nap during the day, your sleep drive will got harmed. It's going to be low because you already slept. And then at night, you will not feel as sleepy, and that will make sleep onset pretty difficult. It's hard for you to fall asleep. If you take nap, like Dr. Wash mentioned, if you take nap during the day, definitely I would suggest you consider taking a shorter nap. And normally we would recommend considering nap for 30 minutes or less. That way it prevents you from going to deep sleep. Because when we sleep, I think Dr. Lanada showed the sleep structure picture. So when we sleep, we fall asleep quickly, we would go into deep sleep. And normally that's going to take 30 to 40 minutes. So if you can keep your nap shorter than that, you will not go into deep sleep. And then you wake up. If you go into deep sleep during nap, and then when you wake up from the nap, you may feel quite groggy, you may feel even more sleepy. It's harder for you to wake up, and you may feel worse at the moment when you wake up. So keep the nap short and keep it as far away from nighttime as possible. Can be really helpful if you are really tired. But for fatigue, we want to consider, like, if you are tired, because fatigue and sleepiness also are different. Sleepiness is you are really like, you can doze off, your breathe gets slow, your head gets nod, and you just feel like you can fall asleep next moment. But fatigue, if you are tired, not necessarily means your lack of sleep. You may just feel tired, but you are not really sleepy enough to fall asleep. Then if you're just tired, taking a nap or resting may not always the best way for you. Sometimes, like walk around, move around a little bit, do some physical activities actually can help you better. And that's something, depends on your situation, you can try or consult with your doctors or sleep specialist about. And also under COVID, a lot of time we change our daytime routines. We may used to go out, meet people, or do physical activities. We don't do that anymore. It's very easy to have a different sleep schedule now. And so this kind of change, any type of change, need our body and brain to adjust to it, and then that can cause some disturbance. At night, because right now we don't have a lot to do outside, so a lot of people start seeing their screen a lot longer, and they start read news and really worry about what's going on, like especially recently, all the politics stuff. So the increased screen time gets in the way of sleep a lot more, and Dr. Zach mentioned a lot about that already. Another thing happened not only under COVID, but also before in general, is clock watching. So at night, sometimes when we cannot sleep, we tend to want to monitor how much I have slept, how much more time left, and how long I have been laying on the bed but not being able to sleep. We have phone, we have like some kind of sleep tracker, we have clock. Nowadays, it's very easy to know what the time is at night. But I would say if your sleep quality already poor, you are not sleeping very well, monitor the clock at night, monitor the time. Most time will increase your anxiety more than helping you. So that's something to think about, whether you want to turn away the clocks and try to not look at them to reduce the anxiety for yourself. Nightmare is something I heard quite a lot earlier this year, mostly about nightmares for COVID, for ourselves getting sick or family member getting sick, or worry about like in the dream, bad things could happen related to this whole situation. And that's definitely like a lot more common. And overall, what can like stop us from sleeping well throughout the day are the worries. And I will talk about briefly about the methods to handle the worries. The worries, anxieties about safety, health, sleep, everything. And the more worried we are, the worse the sleep could get. So let me see the time. Okay, I need to speed up. So just quickly run through some sleep myths, because these are related to our sleep anxiety. How many hours of sleep we need, I mentioned earlier, and we want to set realistic goal. I have to go to bed by certain time. This is also not necessarily the same for everyone, because naturally our circadian rhythm are different. And some people are early bird, means you may feel sleepy like very early, 8 or 9 p.m. and you naturally wake up early, like 4, 5 a.m. Then you're ready to go. You're ready to start the day. But some people are night owl. You won't get sleepy until like 1 or 2 or 3 a.m. and you cannot get up fully functioning until noon-ish. So understand your own circadian rhythm. Don't follow like, oh, I have to go to bed by 10, by 11 o'clock. Not like that. So understand your own body and follow that. It's the best way. The more you can align your bedtime with your natural circadian rhythm, if it's allowed, the higher the sleep quality could be. Another common one is because I don't sleep well, right? I'm worried I may lose sleep, so I need to give myself more opportunities to stay on bed, to rest, or hopefully I can fall asleep. If I go to bed early, get out of bed later, I have more time on bed. That should generate more sleep for me, right? In reality, it's the opposite. The more time we spend tossing around on the bed, being awake, the more anxiety we get, the worse, and the less sleep we get. So we call sleep efficiency is the amount of time you actually fall asleep on bed divided by the whole amount of time you like spend on bed totally, including awake, including sleep time. That's your sleep efficiency. So if you are on bed for 10 hours, but only 5 of those hours you're asleep, all the other hours you are awake, worrying about sleep, then your sleep efficiency is only like 50%, is quite low. And so the way we help with that is to see whether we can cut down the time awake on bed to to help you stay in other places, on chair, on couch. But if there's any risk for falling or things like that, then we have to adjust it to make sure it's safe, and you can do that. And wake up during the night. So a lot of people worry about that. I would say that's something we want know. There's certain research showing that actually it's common and healthy to a certain extent for us to wake up multiple times per night. There's some research showing it's on average we wake up like between 12 to 20 times per night. We just don't realize it. We are just not aware of it. And for older adults, sometimes the frequency can be even higher. So if you experience that and you remember that, don't be worried about too much, and manage the anxiety is still the key. And a lot of this already covered by the previous talks. Here really just to emphasize it, other than what already explained before, there's some things from European CBTI Academy. They have, I add the link in the end. So they have some really good resources. They have the whole paper published to help us to understand the guidelines, what we can do to help ourselves sleep better under COVID. There are some things they mentioned I think is helpful. So because now we have more time at home, we can try to take 15 to 20 minutes every day to reflect on things that are important or appreciative in life, and to handle our worries, and just to use that as designated time every day for us to reflect back on our life in general, to help ourselves get grounded and help us to pull ourselves from all the worries, all the other things back to the present moment. And also shelter in place is quite challenging, but it's also a good opportunity for us to use this time when we have no other obligations outside the house. We can use this time to really find our own natural circadian rhythm and adjust our sleep time closer to it, and to accept, oh, maybe I'm a night owl, I should sleep this time, wake up that time, and actually that can help me improve my sleep quality. If you cannot fall asleep, this all mentioned before, so wind down time, 1 to 2 hours, relaxing. You can do stretching, sleep yoga, listen to music. Some people like to do some cleaning, organizing, whatever you find is relaxing and soothing for you. It can be quite different for everyone. I notice certain activity very relaxing, soothing for one person, maybe very bad for the other person. So find your own wind down routine. And then I already mentioned reduce the wakeful time on bed. If you don't feel sleepy, don't go to bed. Only go to bed when you feel sleepy, you're ready to sleep. If you're just tired, not sleepy, then maybe that's not the best signal for you to go to bed. But you really start feeling this sleepiness, right? Slow breathing, nodding, and really doze off, then go to bed and try to sleep. That is a chance for you to fall asleep. And in the middle of the night, it's similarly reduce the wakeful time. This is similarly, I get this often. If some people wake up around 3 or 2 a.m., it's naturally because we switch the sleep the sleep architecture picture you saw earlier today. We sleep, go into deep sleep, and we rotate there, deep sleep, light stage of sleep for several hours, and then we switch into REM sleep stage. A lot of people will have weakenings around that time that they can remember. So if you wake up around somewhere in the middle of the night and you have difficulties falling back asleep, similarly, we call it 20 minutes rule. Basically, you don't look at the clock, but you just estimate. If you laying on bed for 15 minutes or 20 minutes-ish, you cannot fall back to sleep, you may want to, just not force yourself to sleep anymore. If it's safe for you to get up, leave the bed to go to a chair or somewhere to relax and read, you can do that. If it's not safe, you worry about fall at night, then I did have some success with older adults to just wake up on the bed and turn a direction and turn their body position, and then wake and read book, do some other things, relaxing, soothing with like dim light until they feel sleepy again. Then they try to return to the original sleep position to sleep. And you try that as many times as you need. That can help, if you keep on doing that, that can help reduce the fragmented sleep at night. And there are some relaxation tools. I will not go into the detail, but this can be quite helpful. You can all search them online, find the YouTube video to guide you to do that, to teach you how to do that. Worry time is very helpful if you have a lot of worries. That's use the reflection time I mentioned earlier. Use 15 minutes every day during the daytime. Write down your worries, write down what's the next step, what is the next doable step you can do. And that can help you improve your self-talk at night when you try to sleep. Try to sleep, you worry a lot, you tell yourself, oh, I already handled some of this earlier today during my worry time. I can do this again tomorrow during my worry time. And right now I can sleep. I don't have to worry about them. I don't have to think about them right now. I can handle these worries during daytime when my brain works very well. So that's worry time. So here just some information for you. If you have insomnia, you need treatment, you can find CBTI provider, or you can go to the centers. I believe Stanford has the program. UCSF should have it too. And the European guideline, I just mentioned that they have different sections for, based on your own situation, what you can do, what you can consider to help yourself sleep better. It's open to the public. You can just search it and find it and read it. The online CBTI course, several doctors mentioned earlier, there's several ones out there. I know the one has a lot of research done all through the world. It's sleepio.com. You can check it out, and other doctors may be able to add other resources later. I also interviewed a lot of different sleep doctors before to talk about sleep. If that may be helpful, you can check it out. Okay, thank you very much. Look forward to the questions.
Great, thank you so much, Dr. Zhu and Dr. Walsh. We have some great questions here. And I think a lot of these could be answered by either of you, so feel free to both reply. So one question here, can we make up for sleep deprivation? For example, if we get 10 hours of sleep on the weekend, could that make up for multiple days of 6 hours of sleep during that week?
I don't know what Dr. Walsh think about. So to me, based on what I know of, you cannot really make up a lot of sleep loss. For sleep deprivation, you can make up to 1/3 of that at most. Mm-hmm. So the best way is try to sleep enough, like day to day. If you really lose a lot of sleep throughout the week, just use a weekend to try to catch up. It's not that ideal. I believe there are a lot of research out there on that. Dr. Walsh possibly know better about the literature. And also, I just want to add, if you try to catch up on sleep during the weekend, actually it can dysregulate your sleep rhythm, because that way you don't have a consistent sleep time, wake up time. So that leads to a lot of Sunday night anxiety and Sunday night insomnia and Monday fatigue.
Mm-hmm.
You are shifting it every week, so you are changing your body too much.
Yeah, I'd agree completely. And essentially, as you're shifting and you're sleeping in, it's like you're taking a transcontinental flight. And so you have to recover from the time shift the next day. And so you're setting yourself up for a tough week then, on a repeated continuous pattern.
Great. And so there's been a lot of mention about maintaining a stable sleep pattern and how it's important for sleep hygiene and overall health. Is it also healthier to eat at the same times each day?
Yes. Yeah, because your food can also act as a time clue or a circadian factor. And so having a stable rhythm so that your body is used to also going through, oh, I've now got this increased food, I'm going to break it down, and regulating the hormones around that really helps to have a stable pattern so that you're then ready to fall asleep. And then it helps you also get your day started and get up in the morning better.
Anything you'd add, Dr. Zhu?
I totally agree. The more consistent you can be with all parts of your life, especially eating and sleeping, the better. And for sleeping schedule, I would say if it's really hard for you to maintain a consistent bed schedule, at least try to keep a consistent wake up schedule. Because in the morning, the wake up schedule, if that can be consistent, that really set an anchor for your whole day. No matter when you go to bed, when you fall asleep, but you always try to get up at similar times. Slowly you can shift your whole circadian rhythm back to the healthy state and can help with the whole day.
Okay, and we have a question here about any potential effects of long-term use of antidepressants on sleep.
I don't know if Dr. Wash know more about the literature on this topic.
For the most part, so an antidepressant can disrupt your sleep. However, and so taking them unnecessary can be detrimental, but taking them as needed ultimately is helping your system to ultimately sleep better, because naturally you're helping your depression, anxiety levels. And if they're not regulated or assisted, that's really going to disrupt your sleep rhythms. Taking them long-term, there isn't as much literature that I'm aware of. It's more that if you were to come off those after an extended period of time, that then you may see sleep disruption off and on for several months, depending on which particular medications you are on. And certainly getting the timing of when you're taking your medications is important. So certain medications can increase your arousal, so you're waking, or cause you to be more sleepy. And so your doctor can help you to get the timing of those correct. But long-term antidepressant use, if you remain on them, should not necessarily disrupt your sleep.
And a question for Dr. Zhu. Can you have both sleep apnea and insomnia?
Yes, you can. Actually, if you have untreated sleep apnea, and if you just go through the CBTI treatment for insomnia, sometimes it may not be as helpful. You have to treat your sleep apnea. Sometimes even if it's severe, you have to treat it first. And that sometimes already can resolve a lot of your sleep problem. And if there's anything left, insomnia is still there, you can come back for treatment for insomnia.
And are there any recommended types of breathing exercises for improving sleep, like box breathing or 4-7-8 breathing?
Yeah, both are pretty good. 4-7-8 is something I use often. I don't know for adults. I noticed for some reason teenagers prefer 4-7-8. And also if for people who have panic attacks and a lot of anxieties, a lot of them don't like 4-7-8 because 4-7-8 is count for 4 seconds. and hold it for 7 seconds and breathe out for 8 seconds. This holding stage, for some people, they just really feel triggered by it. I would say the box breathing is pretty good. I believe it's like 4-4-4. And also belly breathing. It's just you hold your belly, you hold your chest. When you breathe in, you make sure your chest does not move. When you breathe in, your belly grows bigger because air goes in. And when you breathe out, the belly shrinks in the whole time, and the air out the whole time, the chest does not move. So it's kind of like the opposite than normally how we breathe. Normally we're like this. We think this is deep breathing. It's not actually is deep breathing. It's only going to the chest and come out the chest, not really go deeper. But if it can go deeper, it gives your lung a better chance to fully expand. And so the whole time it takes longer. And I believe some research shows if we can slow down our breathing to 1 minute, 4 to 6 breathing cycle, that can help reduce our symptoms of anxiety, just help calm ourselves. And that, if you count it, that's a little bit longer cycle of breathing. That's like 10 seconds-ish or even longer for a whole breathing cycle. So that needs you to breathe in deeply and then come out.
Great. And can either of you speak to how dreaming affects sleep quality?
So dreaming is a natural part of our sleep. We all dream, irrespective of whether we actually do remember it the next day. So you're having a deeper sleep or a more extended, good quality sleep, less disrupted if you are getting into your REM sleep periods. But just your ability to recall those dreams is not commenting on your sleep quality itself.
Yeah, totally agree.
Great. How might meditation before sleep help sleep or affect sleep quality? Meditation before sleep.
So it should likely improve your sleep. You're getting, I mean, even if you think about what Dr. Zhu was just saying about the breathing pattern and slowing it down and reducing the anxiety, being more calm, going to sleep, and actually taking those few minutes or a couple minutes even to just get into a more relaxed stage to wind down will help you enter sleep easier and hopefully a better quality of sleep as well.
Yeah, I agree. I just want to add one thing I noticed in my clinical work is it's very helpful, but if we have insomnia, we use that as a cure. We put too much effort on meditation. We think, oh, this is the way to get me to sleep. So I do it before my sleep. I count on that helping me to relax so I can just fall asleep like that. That may backfire. Sometimes, it's become another way we use to control our sleep. It's become a replacement of medication. If that does not work, does not help us, feel sleepy and fall asleep halfway through, we get anxious, we get frustrated. Why meditation does not work for me anymore? What's going on? Am I broken? And that is not helpful. So keep that as we have to think about as a useful tool, assistant, but it's not a method not a magic method to put us to sleep.
That's a great point. And also if you're suffering at bedtime from intrusive thoughts, meditation may not be the ideal thing either for right before going to bed.
And how might drinking herbal tea or decaf coffee throughout the day affect your sleep?
There isn't a lot of research in this. So disclaimer from the beginning, remember that you ideally, if you're having sleep disruption, you do want to try and limit some of your fluid intake before bed so that you're not getting up throughout the night to use the restroom. And otherwise, I think it's everything in moderation. So we've had people that have come in and are just constantly drinking chamomile tea and nothing else, and that's not necessarily the healthiest option. Chamomile tea is great, but in moderation. Dr. Zhu, what would you say in general?
Yeah, I agree. I think decaf still has caffeine in it. So decaf does not mean there's zero caffeine in it, just keep in mind. And for herbal tea, what I noticed I treat a lot of Chinese patients or Asian patients in general. I think depends on our culture background, our belief system. I do notice some certain type of herbal tea has a strong, I don't know whether it's placebo effects or it actually does something to the system because lack of research, but it's helpful for certain patients from certain culture backgrounds because it's strong belief system. So I agree with Dr. Wash, monitor it and try to, you can include that in part of the routine, but just to make sure you use it wisely or talk to your doctors and come up a plan how that can be helpful instead of hurting you.
Great, and last one here. Any tips or recommendations for ways to increase the amount of REM sleep that you get?
Trying to just decrease any potential sleep disruptors or sleep stealers will help increase your amount of REM sleep. Also making sure that your sleep environment is comfortable. So during REM sleep, you lose the ability to thermoregulate. It's part of the natural cycle. And as you heard earlier, your muscle tone changes. So if you're like partially hanging off the side of the bed, you're more likely to fall. If you go into REM sleep, you're going to snap yourself out of it. If you're in a very cold or very hot room, you will often wake yourself up because your body's not doing the thermoregulating anymore. You're relying on the outside environment. And so that can really affect you. So trying to make your sleep environment the most ideal for your sleep is probably one of the better ways to help your REM sleep.
Mm-hmm. Yeah, agree. Just one thing, I'm not sure why you want to increase your REM sleep. I think first check whether is that misperception. You think you are not having enough REM sleep, or you actually are losing REM sleep. Because normally, I think our REM sleep is between 18% to 23% of our whole night of sleep. If you have a tracker or anything, it's not fully accurate, but as a reference point, right? Maybe your REM sleep is normal, but totally agree with Dr. Wash. Avoid any potential things can suppress your REM, because if you suppress your REM for too long, eventually, if those things are gone, you may have a REM rebound. Your body is trying to recover. And alcohol, caffeine, sleep medication, a lot of that, marijuana can all hurt your REM, and sleep apnea. A lot of sleep apnea episodes happen during REM. That's when your airways start to muscle, you lose your muscle tone, right? Your airways start to rest and collapse. And that's when it happens. If you have sleep apnea, you try so hard to breathe in, then it wake you up somehow and disrupt your REM. So check out other conditions, treat them as needed.
Great. Well, thank you both so much. I think that will conclude our second Q&A portion of the symposium. I'd like to thank all of our presenters and attendees for the thoughtful conversations and questions. And a special shout out to Jennifer and everybody else at the Downtown Oakland Senior Center for collaborating with us. And just before I send over to Corey for some relaxation tips, I'm just going to share my screen and give quick mention to our lab, the Kramer team at the UCSF Memory and Aging Center. We are always looking for new research participants and collaborations in the community. So I encourage anyone who's interested to visit our website, which is healthyaging.ucsf.edu, And I will also put into the chat our referral email and this website for everybody's reference. And with that, I will toss it to Ola to introduce Corey, who I believe is going to share some relaxation tips with everybody.
Great. Thank you, Eiley, and thank you, everyone, for your participation today. Now we're going to have Corey Action presenting relaxation tips. Corey Action is the owner and founder of the New Style Motherlode Dance and Vera Project's nonprofit organization. Many of you will recognize Corey as a substitute teacher for the Monday to Wednesday aerobics classes held here at the downtown Oakland Senior Center. Corey, the floor is yours.
Oh, thank you so much. Can you guys hear me? Yeah? Thumbs up, thumbs down. I can't even see anyone. Looks like it's us, Dewan. Well, good afternoon. My name is Corey Action. I am from New Style Motherlode. And I have had the pleasure of really physically putting my grandparents to bed for years. So I didn't learn this from a doctor or anything. I've been teaching dance for almost 30 years now. And so just putting some elders to bed and getting them relaxed. First thing I always tell them to do is turn off the television. Something about the blue light and the way that the shine is, it can linger for hours when you're actually sleeping. So I always tell them to cut the TV off and maybe read a book or just relax and pray. My grandfather, he would always pray on his knees nightly, all the way up until he was 98 years old. And my grandmother did the same thing. Today is their actual day of passing together. They didn't pass together, 6 years apart on the same day, and 69 years married and 71 together. So what I would do with them is I would come over basically nightly for maybe like almost 10 years. And we would sit down on the bed and have a little conversation. I hope you can see me. And what we would do is we would just relax, breathe. I always told them to breathe, take 10 good deep breaths just to let their body know that they were going to be relaxing. Because if you take those deep breaths in and out for like a few seconds, sometimes the elders will not be able to take a really deep breath, but they can get a little something in. I would do this 10 times, yes. And then I would just ask them just to relax their head, look down, and look up. Make sure that their eyes are going the way that they're going, not to just be moving their head, but actually move their eyes first, down and up. We would try that maybe 5 or 6 times. It just depends on what we're feeling at night. Side to side, same thing. Feet on the floor and just arms to the side. Yes, yeah. If they can go side to side, that would be great. Sometimes the motion is a little restricted when they're doing these kind of movements. Even doing around in the front, I would, not necessarily in the back, but around in the front there. And breathing. And just relaxing through that, not to go super fast, but to take their time with this. Lifting their shoulders up towards their ears and relaxing. And lifting up with a deep breath in and relaxing. Maybe 5, 10 times, whatever they're feeling at that night. Not all the time the elders will do it. They may not feel like they want to do it 10 times. So you just go wherever they want to go. Rolling the shoulders back, if they can do that, and forward. Just taking a deep breath in the middle of those things. Breathing really, I heard some people talking about REM sleeping and just being able to relax the mind and really go into those dream states. I've also put their hands on their knees, and I do things like move our fingers. Sometimes we forget that we have fingers and toes, so I used to tell my grandparents to move their feet, move their toes, move their fingers, even if they can rotate their wrists, if they can wave, do things like this, where they just are able to do full motion, or as far as they can go. I would tell my grandpa, because he had huge hands, so I'd be like, put your big old hands together, Grandpa, and just put them over your head and just stretch up, taking a deep breath in and relaxing. He didn't get them up this far, I will tell you that, and some elders do not. Some elders are about right here. And I tell them just to move over to the side if you can, and breathing the whole time. Opening up, yes, good. And just relaxing those shoulders and the body. And I would tell them to move around as they do this. It should only take around 5 minutes of their time. Anything else is going to be way too long for them. Going back the other way. 2 or 3 times, whatever they're feeling. If they can do 6, if they can do 10, that's great. Even putting their leg out, heel to the floor, toes to the floor, heels to the floor, toes to the floor, heels to the floor, toes to the floor, heels to the floor, and toes to the floor. I would ask them to just lift their heels up if they can. With the Achilles tendons, it gets a little tight there, and sometimes they can't really bend their feet back. But if they can just do it for a second or 2, that's always great. And even opening up the heels and the toes. If you do the toes first and then the heels, what I've learned is a lot of people cannot do the heels and toes like this. So sometimes they'll do both, which is fine also. I never wanted to restrict my grandparents and what they were doing. I just said, just do what you can, Grandpa, do what you can, Grandma. Yes, even doing circles, which is something that they can do before bed. The idea is that their body will be loose and relaxed and not all tensed up from the day that they had. Yes? All right. And then we will move to the side because they're always sleeping. I'm gonna move my microphone over a little bit so that I don't get distracted. And as they lay down, to lay down on their back and just take some deep breaths in. And bring their hands together if they can. If they can bring their hands on their chest, sometimes they can, sometimes they can't. And I would just say, open your arms, bring them back in. Open your arms and bring them back in. And just relax, Doesn't have to be on any kind of count, just so they are able to move their bodies around and relax. And I would bring her feet in. Yeah. Grandma could do this really well. Grandpa couldn't. Grabbing one leg and just straightening one out. If they can, they can do that. And then switching sides. Yes. Leg out and leg in. Yeah. Breathing into that. And there's always something they may have learned, like if they were in any kind of care, to just drop the legs to the side there. And if they can get them back up, sometimes you may have to help them if they're not strong enough in their center. And do that a few times there. I always tell them also to not do the big pillows, to try to have a pillow that's sort of flat so they're long and not up like this here, but really flat there. Yes, and over to the side. Good job. Yes. And then straighten their legs out. And if Grandpa is tall like me, so I don't think they had a king size bed, but I just put their hands in the air. Then I would tell Grandpa just to grab the backboard, because some people have a backboard there, and just really just hold it there, so that blood can flow. And then release that and taking it up again. Even do one at a time. Good job. Yes. And like I said, believe it or not, this was like a nightly, thing that we would do here. Yes. I also would tell Grandma, because she had more motion, so I would tell her to like really stretch her arms up. Just really get a good stretch in. Breathing in and out. Even turning to the side, which is hard for Grandpa. Grandma could do it. Just turning to the side here and relaxing. Yep. And just straightening out the legs if they could. and then bending. One of the things that happens here is that wherever your position is, your body remembers this position. So when you're sleeping, for some reason, I'm not sure why, but you'll go back to this position if it's comfortable. And then to switch over to the other side, same thing. And like I said, Grandpa could not do all of this. He was a big dude, 6'4", and like probably 200 and almost like 60, 70 pounds, but solid. So it was, sometimes it got hard for him to move around, but we always kept it very easy. And then about now, like I could tell you, around 3 or 4 minutes into this, Grandpa was like, okay, I'm tired now, I want to go to sleep. He normally would stay sort of in this position. However, my grandmother, she would stay on her back here. And she sort of, I don't want to say this like this, but she sort of slept like she was in a coffin. She would always be like sitting there like this. But I always made sure she was like taking deep breaths, relaxing her mind, and her body. One thing about going to sleep when you're an elder, you have way more memories that go through your head. So with Grandpa, he would always have these kind of thought patterns, not necessarily nightmares, but it was definitely something. He would always have something to think about when he was going to sleep. So what I would do is I would, if I was there, I would talk about, my childhood or the cookies or the cake or whatever the family was doing, so that he could relax in the good times and not in the time where he was remembering, childhood and 1930 or something like that, which is a totally different time. And it could, I'm sure, it affects your sleep. So sometimes I would talk to him. Sometimes he'll talk to himself. He'll read the Bible. He always prayed. But the idea is to take those deep breaths and just to have a good thoughts in your brain, not the news, not the not the scary movie, not the sci-fi, not the mystery movie, but just some good thoughts about, like, family and friends and food and cake and ice cream. And as you take those deep breaths, what you learned is that what I've learned is that you do relax and your body starts to settle into those positions because you were able to like stretch and move around. So now you're like, okay, I'm ready to go to sleep. And taking those deep breaths. I've told Grandpa to take 10 breaths before he thought he was going to go to sleep, and usually he could make it to around 6. And with that count, it's sort of like counting sheep, which is very basic things you tell kids to do, but it's something that we can do also. Just to count backwards, or take those deep breaths, and before you know it, they're gone. All right. Yeah, so that's what I normally do. That's what I was doing with my grandparents before they passed away, and I did it for a very long time. So I know it works, and I always tell the elders, just to get to get a good night's sleep, just to relax their mind, and please turn off the TV, because that whatever the light is, it's sort of bluish or whatever that light is, it can keep them awake. So just being able to turn that off, move their body around, take those deep breaths to make sure that they are relaxed and ready to go to bed. And so there it is. I hope that's something that can help you out. Like I said in the beginning, like I didn't learn this from any books, even though my mother was a nurse. I didn't learn this from books. I just learned this from experience, being with the elders all the way through, and making sure that they could have a good night's sleep, and their body would feel good. And Grandpa always felt good in the morning. Grandma didn't always feel good because she would still be up drinking coffee in the middle of the night, but that's what it is. Thank you very much. My name is Corey Action, and I hope that helped out. I know some of you guys are doctors and everything like that, but I'm just a guy who took care of old people in my family. So thank you so much. Peace and love.
Wow, thank you so much, Corey. That was so great.
You're welcome. Thank you.
Thank you. So now we're going to move on to the prize drawing, and I'll give it to Jennifer to take away now. I'm going to go ahead and share my screen for this part. Okay, give me 1 second.
Everyone. So we're all at the end of the day, and staff have been busy setting up names in a journal. Some winners for First Safeway gift cards. And on the screen, you see those names, and they are Carol Braves, Adrienne Beasley, Kathy Eamon, Diana Sims, Angela Safi. The phones are ringing already. Norman Lemoyne, Lawanda Manor, Mativa Guhu, Yvette Vasquez, and Elizabeth Smith. You are our winners, and you now have 15 minutes to call the center to claim your prize. If the prize is not claimed within 15 minutes, we have pulled 5 standbys. But we hope each of you will call. Please be patient. We have 3 incoming lines. So be patient. Don't try to leave a message, but you need to speak with one of us. So you have until 10 minutes until 1, that's 12:50, to call us and claim your prize. And before I step away from the microphone, I want to thank all of our presenters this morning. We especially thank Dr. Sergio Lanata, Dr. Shelley Zach. We thank our own Corey Action, of course. We want to thank Dr. Yasan Zhu, Dr. Walsh, and our wonderful co-hosts this morning, Miss Eiley and Miss Ola from UC San Francisco. And of course, to all of our attendees this morning. A word to our drawing prize winners. We've got calls coming in and only 3 lines, so we cannot have extended conversations. Please allow staff to take your name and your phone number. We will call you back and arrange for when you can pick up. To all of you, again, thank you for participating. We would love to hear your comments. We'd love to know how today's session has benefited you. And I'm going to ask if you do that by sending me an email. And my email address, which I just sent to everyone in the chat, is jdking@oaklandnet.com. That's jdking@oaklandnet.com. And we would love to have your feedback. Again, to each attendee today, thank you for your continued support of the Senior Center. And we're delighted that you could share with us this morning. To our friends and collaborators at UC San Francisco, thank you for your generosity. We reached out to them and they immediately said yes. And we appreciate all of you, the thoughtful presentations. Corey, can't love you enough. Thank you for that stretch. I'm gonna try some later tonight. But again, our winners, if you would please give us a call. If our 10 winners do not call within the allotted period of time, we will reach out to the standby winners. We'll reach out to you and let you know that you have won by default. But a win is a win, right? Okay, so listen, everyone have a wonderful, wonderful weekend. Take care of yourselves, continue to be safe, and continue to remain hopeful. Thank you so very much.